Now, the world is tackling a sharp surge in the number of COVID-19 infections, mainly thanks to the Omicron variant of the coronavirus. The World Health Organization has something as a pretty dire warning, where it has said that the Omicron variant is spreading and replicating further. And it could get more likely that there will be more newer variants that could prove to be more dangerous than the variants that we have witnessed in the past. Listen in to what's been said.
Still at a phase where the virus is evolving quickly. The more it spreads, the more it transmits, and the more it replicates, the more likely it is to throw out a new variant. Now, Omicron is lethal. It can cause death. It can cause hospitalization, maybe a little bit less than Delta. But who's to say what the next variant might throw out? So we're not at a situation yet of being able to count on herd immunity. We need still to have the same approach. The strategy stays the same.
All right, we can't count on herd immunity. Now, this warning has come after the WHO said that there was evidence that the new variant is actually milder than the previous ones. The latest studies indicate that the Omicron variant is affecting the upper respiratory tract, causing milder symptoms at this point of time.
We are seeing more and more studies pointing out that Omicron is infecting the upper part of the body, unlike other ones, the lung, who has been causing severe pneumonia. It can be a good news, but we really require more studies to prove that. We had a good number of studies coming up, proving again what we had from South Africa, that the vaccine still protects you against hospitalization and severe disease and death. And that's what vaccines were designed. The challenge has not been the vaccine, but the vaccination and reaching those vulnerable populations.
Now, the WHO has also said that the Omicron's high transmissibility means that it will be the dominant variant of the coronavirus within weeks in many cities. This will certainly pose a threat in countries where a high portion of the population still remains unvaccinated. On whether the world will, of course, need an Omicron-specific vaccine, the WHO has said that the global coordination and more cooperation is needed to take such decisions, and it must not be left to the commercial sector to decide on this issue. All right, now to give us more perspective in terms of the Omicron variant of the coronavirus and how different it has been from the previous variants of the coronavirus, we are joined in by Dr. Jayaprakash Mulyal, who is one of India's foremost epidemiologists and also the chairman of the Scientific Advisory Committee of the National Institute of Epidemiology. Dr. Jayaprakash, thank you very much indeed, sir, for joining us on this broadcast on WION. And let me begin by asking you this. You know, over the course of the last couple of weeks, we've witnessed a dizzying surge in the number of infections in areas such as Europe and North America, where we are given to understand that the rate of vaccination is pretty good. But despite that, the number of people who are contracting the Omicron variant of the infection is a cause for serious concern. So what do you think?
Yes, to an extent that is true, but I have a feeling it is inevitable. And even in India, where the numbers are coming down, suddenly the rise has started. And this is consistent with the theory that there is a new person in the attacking us, and it will prevail. Now, the good news is that it is not as virulent as the previous visitors.
No, it is not virulent. At least it has not proven to be as virulent as the Delta variant. But the WHO also has a pretty dire warning, where the WHO has said that the continued spread of the Omicron variant across many nations around the world could potentially lead to the emergence of more new mutant variants of the coronavirus, which could be much more deadlier than what we have witnessed in the past.
That's always a possibility. Now, the pertinent question here is, so what do we do with the current epidemic of Omicron? Do you block it, waiting for a more serious one, or take it because there is a considerable amount of vaccination in India and large number of population have been infected already? So I think I want to encourage at least the government of India to face this much more calmly than we did in the earlier waves.
That's interesting when you say that the government needs to be much more calm in taking on this virus. The government has also already started to issue guidelines in terms of restrictions and in terms of restricting public activity, especially on the weekends and during the nights. Do you think these measures of imposing restrictions over the weekends and also in the nights is likely to help curb the spread of the Omicron variant?
I guess not, but it keeps an awareness that something around is, there is something amiss, so some restrictions are there. The point is restrictions when it affects livelihood, restrictions when it affects admission to hospital for other serious illness, then this will be counterproductive. So I think this kind of a mild restriction may not affect life of the people or their earning capacity.
And also there are countries like Israel that are experimenting with, the second booster shot. That will be the fourth dose of the COVID-19 vaccine. Are these measures that we can look at in India?
Well, by the time vaccine became available in India, more than 85% of the people had already had natural infection. Then came the vaccine. Biologically, the first dose itself was a booster shot, and many received a second dose too. So from the point of view of additional booster, I don't see any biological rationale.
All right, so that of course is something that we'll have to see. Thank you very much indeed, Dr. Jayaprakash, for joining us and getting us all those insights. This of course is a story that we will continue to track on WION, the spread of the Omicron variant, and the WHO has given a pretty dire prediction as to what could happen over the course of the next few days and weeks. WION is now available in your country. Download the app now and get all the news on the move.